Good evening, everybody. Thank you for coming. My name's Cliff Weiner. I'm president of the POA. First on our agenda tonight is we're going to rise for the pledge to the flag and remain standing for a moment of silence for our first responders and military personnel. Thank you. Please be seated. You have to bear with me. I forgot to bring the printed copy of the agenda, so I have to do it on my computer. Okay, our secretary and our treasurer both are not here, so tonight we'll dispense with the reading of our minutes and the treasurer's report, and we'll have them next month. So something I usually do is introduce any district personnel that might be here. There's a few. To my right is Dan Warren, who's on our board and is also a member of the NSCOD board. Mark Hayes is in the audience. He's a District 4 supervisor, and I also am a District 4 supervisor. So we will have no discussions in District 4 because of sunshine laws. Have to be careful. Back table, we have our friends from Suncool, Realty Execs, Rate, Reverse, Realty Execs, and of course, the lady that takes care of our membership, Donna's in the back. Our meetings are video recorded and live streamed on our Facebook page, POA of the Villages. It will be posted onto our website tomorrow, or maybe even tonight if I get it in time, but probably tomorrow. And then it'll be on our Facebook page tomorrow also, so you can go back and look at it at any time. On our website is every meeting we've video recorded since June of 2021. So we've done a whole bunch of them. And speaking of that, just so you know, it was something that I thought was really important. So for the last 4 years, I have been encouraging district staff to video record our district meetings. Starting in July, that will be happening. It's a huge step because now you can go and watch any meeting you want when you're bored and have nothing to do at 2 o'clock in the morning. Give me a second. Okay. Okay. In the bulletin that will be coming out next Thursday, they'll probably start delivering on Thursday and Friday of next week. There's important changes coming to the POA. It's all laid out in that bulletin. Please read it. And then next month, if you have any questions, and come to the meeting and ask, and we'll try to answer them. But there's some really important changes coming, so you need to be aware of what we're trying to do. We're trying to get in the 21st century. So it's about time. Because in November, we're going to have a big gala because we celebrate our 50th anniversary in the Villages in November. We're the longest serving group in the Villages. We've been here since day one. That's really, we're the only group that can say that. So it's kind of important. And Reb didn't give me that. How many people are signed up for e-notification? Please, people, go to districtgov.org and sign up for e-notification. I believe in 10 days, we start hurricane season. And if you want to know what's happening, you can click on a box that they will send you all the information when we're in a hurricane. Staff does a really great job of keeping you informed when we're in trouble. And you can choose and pick out of hundreds of topics that you want to be notified about. When a golf course is going to be closed, if you're a golfer. So pickleball courts that are closed, maintenance at issues. It's really, really important that you sign up for it and you stay informed. So since we're way ahead, this is a part of the meeting that we call our open forum. If you have a question, raise your hand. Wait till somebody comes with a mic, because as I said, we video record these. We need to be able to hear you, and I'll try and answer it. If I don't have an answer, I'll get one for you, and it'll be in the bulletin next month. So anybody got a question? Well, we must be doing a really good job. Lately, we're not getting any questions. I missed the questions. Okay, I don't see any. I'm sure they'll have some after our speaker. I will tell you that tonight's speaker, Dr. Young, was kind enough to switch. He was supposed to be the speaker next month, and Dr. Curtis was supposed to be the speaker tonight. I got a phone call on Friday that Dr. Curtis got invited to the White House today, and the White House trumped the POA, unfortunately. No pun intended. But when I talked to him, I said, go and have a good time and let me know what happens when you come back. He will be here next month, so hopefully he won't get invited to the White House again. Just real quickly, next month is Dr. Curtis. In July, Dr. Young is going to do a second presentation on 2 different topics. We have 2 meetings in July, one at Everglades, which will be Dr. Young, and one right here in this room, which will be Bradley Arnold, on the Sumter County budget for 2025-2026. And the budget workshop for Sumter County is that morning, and that afternoon or evening, he will be here giving us the latest information. So we'll get it before anybody. If you have any questions or are interested, that's really important. In September, we have Dr. Norman Anderson, who's got a really interesting topic to talk about. And in October, we're going to have the sheriff, Pat Breeden, here. And I haven't found anybody yet or looked for anybody for November or December, but I'm sure we'll find somebody. So with that being said, I know Dr. Young's here somewhere. You're up. And as I said before, just stay in this area so we can get your pretty face on the camera.
All right.
And again, thank you for switching, because that really was nice of you. Thank you.
Glad to do it. Glad to do it. First time I've been to the Villages. Very impressive. Very impressive. A little bit about me. I am not 7 feet tall. I'm only 6'6". And I used to be able to dunk a basketball. I gave up basketball, though, and I'm heavily into tennis, played tennis for my university. And my son's a tennis player. The whole family's tennis. First of all, I need to apologize, especially to you, Bill, and your wife, because when I talk, I tend to spit. So you said there'd be some towels up front, so you just don't have to take a shower tonight. You in the back, you're fine. You're fine. That's why. So the day I finished my master's degree at University of Missouri, Kansas City in public administration, city management, I decided I wanted to be a doctor. So the day I graduated is the day I started my pre-med. And went through all my pre-med, wrote the big letter to get into medical school, as naive as I was, and I said, I want to become a doctor because I want to cure sickness and disease. Quit laughing. And someone must have liked it, because I got accepted in medical school, did my first couple years anatomy, physiology, biochemistry, genetics, did my rotations, went off to residency. First year of residency was internal medicine at the Huntington, West Virginia VA hospital. And after about 6 months, because I am a slow learner, I started to realize that, there's about 40 veterans that kept this hospital going. They'd be in for 2 weeks, they'd be discharged for 2 weeks, in for 2 weeks, discharged for 2 weeks. It was just a circus. So I'm in the intensive care unit about 6 months in, and I'm with my chief resident, Robert, and the fella, we're waiting, I'm intubating because he has trouble breathing, so waiting for the anesthesia to take effect. I said, Robert, you ever notice that there's just a few veterans that keep this hospital going? You know, they're in and out. We never get them better. What if we tried something really wild? What if we actually tried to cure these guys? Young, you want to finish your residency? Yep. Then you shut up and you do what everybody else does. So I zipped it and I shut up and I got through my residency. But it always kind of bugged me, you know, why I wanted to get people better. And I was starting to realize that maybe that is not the job of the American doctor. Maybe it's more to slow your progress to death. So finished my residency, and because I was so overworked in residency, I took a very tough job with Royal Caribbean Cruise Lines as the love boat doctor on the Nordic Empress. Spent some time there on the ship, finished that, went off to South Africa, ran a pediatric burn unit, 36 beds in the burn unit that I ran. Tampa General has 6 beds. Did some work for the United Nations Border Relief Operation on the Thai-Cambodia border. You know, they lied to me. They never told me that was a war zone. And they do not build foxholes for guys 6'6". And when they're firing those rocket-propelled grenades, not nice. Came back to the States and started doing emergency medicine. And I enjoyed that. But every once in a while, I would realize, you know, it's great to be able to sew someone up or start their heart again, you know, life-saving maneuvers to save them. But for a lot of the patients, it was just, you know, they're diabetics out of control, get the blood sugar controlled, send them home. They come back in a few weeks, get them straightened out, send them home. And after 15 years of this, I was like, I've had enough. I am not happy about the way I practice. It's very boring. I just follow the algorithms that I've been taught. And as long as you follow those, the chance of Morgan & Morgan coming after you are very, very small. So finally, I was about to quit medicine, and I met a guy that was head of Eckerd Pharmacy. Remember Eckerd Pharmacy? Yeah. Was head of their nationwide mail drug program, and said, John, there's something wrong with this medical system. And so he and I teamed up, and basically we decided we're going to treat not from the pharmaceutical standpoint, although, listen, if they have strep throat or an infection, I love the antibiotics. Did not want to get rid of those, but we wanted to get people better. So we looked at patients from a biochemical genetic standpoint. Because once we stopped reading the Journal of American Medical Association, Lancet, New England Journal of Medicine, and we started reading cellular and molecular biochemistry journals, and if you're tired, those will put you to sleep instantly almost. Neurobiochemistry, started reading those journals, it was a whole different world. And they talked about actually getting patients better. So I'm in my practice down in St. Petersburg, and one day a lady comes in with her husband, who I've known them for a number of years, and he had a stroke, severe stroke, and I was seeing for the first time he'd been out of rehab now. And, you know, stroke is really pretty easy. You know, as an ER doc, the ambulance or family will bring in husband, wife, someone's had a stroke, and usually a stroke is caused by a blood vessel either breaking, get a bleed, or something blocks it off. If they get to us within 6 to 8 hours and it's just a blockage of the vessel, we can give drugs to open it up, and there's a very good chance you may walk out of that ER completely normal. But for a lot of them, we don't know when they had the stroke. The wife wakes up in the morning, the husband's not moving, diagnosed stroke. We don't know when it happened. So we would stabilize them, send them to rehab, go home. Neurologist would follow up after 6 months and basically say, well, that's all you got. That's about as far as you're going to get. Right? That's kind of basic neurology 101 stroke treatment. And so I'm thinking about that, and at the same time, there's a neurosurgeon, neurologist over in California who's saying the same thing. You know, this stroke thing, there's got to be a better way. So he started thinking about this, and he thought maybe it's just a lot of inflammation. And in the brain, especially, once you start inflammation, it's like a dog chasing his tail. It keeps going on and on and on and on. So he started looking at some anti-inflammatory drugs that he could use. They've done studies with steroids and stroke. It hasn't worked out very well. Progesterone and strokes hasn't worked out that well. But there's a class of drugs that he was looking at called immune modulators. You've probably seen them advertised on TV. Skyrizi, Humira, Enbrel, those type of drugs. We use them for psoriatic arthritis, ulcerative colitis. And they had some very unique properties. But the problem is they can't get it past the blood-brain barrier. So you give an IV of that, it will never get into the brain. So he started doing some research. And, you know, you talk to doctors or med students, all that, they want to get the latest and greatest. You know, so they're always, studying and reading the journals and coming up with the latest and greatest. And he said, I don't know if that's really that helpful. You know, there's about 8,000 medical articles that come out every single day in the world. You just can't keep up. So he went back to the old literature of medicine, to the 1544. Hungarian anatomist discovered a vascular system that surrounds the spinal cord and the brain, and there's no valves in that system. So there's no barrier. Now, he was thinking, how can I get one of these immune modulators into the brain? Because it's a large molecule. It won't cross the blood-brain barrier. So there's two ways that neurosurgeons, neurologists, surgeons, everyone I've asked, professors of medicine, UCLA, there's two ways they know of to get something past the blood-brain barrier. Either go through a lumbar puncture in the spine, but try doing that to an 80-year-old person with arthritis. Or, Bill, can we do that maybe? Just try for the group's sake.
Been there, done that.
Or you can go up through the neck, through the internal carotid, but if you miss and puncture something, you've got about 6 minutes of life left in you, and that's kind of a bummer. So this anatomist discovered this system, and there's a peripheral branch to this system that no one knew about. There's actually 5 of us in the U.S. that know where that is. I'm the only one that's used it on kids under 18, but I also now use it on adults. And it's somewhere on the back, and I go about that far under the skin, 1/4 of an inch. That's what he did. He went about a quarter of an inch under the skin, gave the drug, and it got right into the blood-brain barrier. So he's doing this on, just testing it out. And then he's like, I need to try this on a real stroke patient. Now, I love the drug studies that they do. Like if there's an Alzheimer's drug or a, stroke drug, they want someone who has mild dementia or a mild stroke. Maybe their index finger's a little numb or something. They never want the worst of the worst because they want the studies to look good. So word gets out that he's looking for a volunteer. A family comes up to him, says, our mother was a school teacher 13 years ago. In between classes, she went to the faculty restroom and never came out. Class started. Where's Mrs. Jones? Looking all over. They found her in the staff bathroom on the floor. Massive stroke. Mostly blind, completely demented. No one could understand her. I think the right side of her body was paralyzed. She was one step above vegetable. And for 13 years, laid in bed. And they said, you know what? We would like for you to try this on our mother. Okay. So they brought her in. He gave her the injection. It takes about, it takes about 4 or 5 seconds to do it, which can be a long time for some people, short time for others. And then waited. After about 10 minutes, they noticed that she could actually follow a person in the room. In other words, her eyesight was coming back. About 30 minutes later, she started to talk clearly, competently. To make a long story short, after 8 hours, her limbs moved. She recognized, she understood, she could speak. And she went home and got physical therapy because after laying for 13 years, you're going to need some help. But 8 hours later, this woman is basically back to normal. So he did a few other patients, and then no one wanted to listen to him. So he got in touch with the University of Melbourne in Australia. They were interested. And they said, you know what? We would like to do a study. We want to do a year study. We will get the patients. We'll blind it. And let's follow these patients for a year. 614 patients. The average age of the stroke was about 5 years. There were some that had one 6 months earlier. Some, oldest one was 11 years. 614, 307 got a saline shot in the back, and 307 got an immune modulator. They did this for about 2 months, and then things started to fall apart. Because a number of patients got better when they got a shot within 5 days. And it was about 70%. And then the whole group started talking with each other, and they demanded that they unblind the study. It was not going to be a year study. It's kind of like strep throat. We're going to do strep throat, see if amoxicillin 3 times a day for 10 days wipes out a strep throat. Do you need a year to study that? No, about 10 days. So they unblinded it. And the ones that got the saline, they got the Enbrel, which is the drug they use. And sure enough, about 70% either had a complete or partial reversal of their stroke. Because the idea that I was trained at is this: you have a stroke here, everything out here is now dead. He just disproved it. The university study, that is absolutely false. All he did was give an anti-inflammatory, got it in the brain, and people started to get better. It's about 70%. So he came back to the States, started practicing. 5 of us know how he does it, what he did. So I'm in my practice, and this lady, who I'm seeing her husband, who had the stroke, gave me all the information on what this guy did. And that's why one thing is I love my patients, because honestly, they keep me up to date, because I'd never heard about this. So I went through all that information, figured it out, gave him the drug, and guess what happened? Nothing. Nothing. I was so bummed out. But I knew it wasn't 100%. So a short time later, I had a guy who used to do carpentry for us up in Michigan for the summer. Early June, and the wife calls, John's had a bad stroke. Partially blind, left side's paralyzed. No more carpentry work. Sorry, John. We'll be back in October, and we'll stop and say hi. Came in October. He was a mess. Still told great jokes. So I gave him the drug. 10 minutes later, he's still bad. The next morning they call, he's completely normal. 24 hours. Then I had a woman that had a stroke in the optic artery, so that she, with her right eye, she can only see straight ahead and to the left. And I just said, please make sure I'm not on the road when you're on the road. It has no peripheral vision. So we gave her the drug. 4 minutes later, her vision now is almost 180, almost completely there. Had a doctor come in to see me, stroke, gave it to him, didn't do anything. Had a woman come in, severe stroke 3 years earlier, right side paralyzed, but her problem was the pain was unbelievable. Just, John, it is an 8 to 10 constantly. I never sleep. This has been going on for 3 to 4 years. Honestly, in a way, I wish I was dead. I gave it to her. Comes back next week. Completely different woman. The right leg is just fine. The right arm is more movement. But her pain has gone to about a 3. I said, do you want us to do it again? No, listen, I can sleep in a bed. I can get 8 hours of sleep. You've changed my life. And so we are about the same as the other guys in Melbourne also. It's about a 70% success rate. It's not 100%. But why I went into medicine was to get people better. And what's very interesting is you learn all these algorithms for all the different diseases, and that's all they teach us. In fact, a 5th grader could do it. So I had a neurologist, he was internist, call me one day, and he wanted to learn how I did it. And I said, let me ask you. You're a Baycare doctor, right? You work for Baycare. That's St. Anthony's, St. Joe's, Morton Plant. Even if I told you and showed you how to do it, they wouldn't let you do it. You know what he said? You're right. They would not let me go outside the protocols. So I said, I'm not going to show you. It's a waste. Because you will never be able to do it. That's why I am on my own, so I can do whatever I want. But, it's sad to have to tell him that listen, you can't do it. But the things that I hated strokes because there wasn't much to do. And I love to treat people with strokes. Because my algorithm is a lot bigger than the head of neurosurgery or whatever. Now, one of the problems with people that have a stroke, how am I doing on time? Okay, don't say it. I don't have to be at work till 8 tomorrow. So, if you've had a stroke or a neurological incident like that, the rates of dementia go up to about 25%, which is kind of a bummer. So I started looking at dementia. And one of the first cases I looked at was a case of Lewy bodies dementia. Heard of that? All right. You want to explain it to my son over there? Oh, no. So, Lewy bodies dementia, usually find in Parkinson's patients. But a friend of mine said, listen, I have a good friend. He's down there in Naples. You need to have him come up and see you because he needs help. So we call the wife. She brings him up. He is a high retired government official, very high up. Wife, he picks him up and he comes with his little walker, sits down, and promptly goes to sleep. Try to talk to him. He's a loon. He is a complete loon. But at least he can still work for the government. I did not say that. Wait, redo that. I did not say that. Just completely nowhere. And trying to tell me something, and I don't know where the Buccaneers came in about a stroke or whatever. And then promptly falls asleep. And the wife is telling me, John, we've been married for 50 years. I never thought I'd be raising or having another child. It is a 24-hour day job. Plus he has the Parkinson's. I need help. So, in looking at, all right, let me just say this. About 3 years ago, whether it's divine intervention or not, probably is, but I used to wake up at 3 or 4 in the morning and start reading these biochemical journals. And they talked about dementia. And they talked about, in very small studies, reversing it. And so I basically, after 3 years of reading that, said, I'm going to do exactly what the biochemistry journals do. So I said to the family, here's what we're going to do. In all dementias, depression, strokes, post-traumatic stress disorder, there's always an inflammatory aspect. I gave him that drug we used, monoclonal antibody. I gave it to him. I then gave him umbilical cord stem cells. Not embryonic, no dead babies, umbilical cord stem cells controlled by the tissue banks here in the U.S. But I gave it through the vertebral vascular system. So when I gave it, within about 4 seconds, it was into the brainstem, into the caudate nucleus where Parkinson's is, but where the Lewy bodies are located. And I also gave him something called exosomes, which is a part of the cord blood. which kind of has to do with cell-to-cell communication among the brain nerves, but also acts as a sanitary sewer. It gets rid of debris. And one of the things it gets rid of is Lewy bodies. All Lewy bodies are, and I'm getting ready to publish that article because it's the first time in medical history that they've ever been able to get rid of Lewy bodies. I have the pre-CTs, the post-CTs. There are no Lewy bodies. It's the first time in medical history. And so I gave them that, had a phone conference after about 6-8 weeks. Not much going on. Still, a little bit with it, but not much. And then had a follow-up 8 weeks later. So it's been 16 weeks. I go out to the office, reception area, and I call the family back. He pops up. There's no walker. Comes down, cracks a joke. Where's your wife? Oh, she's so slow. She'll be here in a minute. Joking with me. I'm thinking, seems kind of normal. She comes in. I said, well, how's it going? Look at him. He's back. I got my husband back. Mind as clear as a bell. The other nice, interesting thing is he has no more Parkinson's. But they hired me to clear his mind. The side effect was the no more Parkinson's. So a little bit later, I had a wife bringing her husband who's a little bit not as sharp as he used to be. And wants us to get him better. So I said, all right, we can try some things. And I did use the umbilical cord stem cells. I did not use, I don't think I used Enbrel the first time. I used exosomes. And then the wife told me this, we're leaving in about a week or something to go up north to visit relatives for a month. Oh, you're really killing me here. So you're going to take a demented guy up north, and he's going to be in a different house every night. It's a disaster waiting to happen. But can you really tell a woman anything? No, you can't. You can't. I've learned that. So they're off, and I call him about 8 weeks later, and he answers the phone, which kind of surprised me. How was the trip? Great. Saw the relatives, and it's just fun to reminisce and, all of that. And did you drive? Oh, yeah, I did some driving. Ooh, that makes me nervous. Listen, let me speak to your wife. She comes on. So how'd it go? Went great. Yeah, we shared the driving. And he's back. Now, I did some other things with him because from my biochemical reading at 3 in the morning, I added something called 4-aminopyridine, which is an old drug. But in all neurological injuries, there's a problem in the potassium channels. Remember that because that's going to be on the test. All right. The potassium channels control the electrical output of each firing of the nerve. And in these brain damages, they fired about 10 to 40 millivolts of energy. You need to run it at about 75. It's like the lights are always dim in here. Could someone turn them up, It's not a potassium problem. It's that the channel, the potassium goes in and it falls out. There's a problem in the channel. You have to fix the channel. 4-aminopyridine closes that channel. So I closed the channel and the electrical energy and the cell comes back up. And so it's very interesting to see how well that drug works on almost any neurological problem. Now, in these articles, it's talking about 4-aminopyridine and saying we're going to try to find a drug that we're going to try to develop a drug that works as well as 4-aminopyridine. And I'm thinking, I got to read this again. You have a drug called 4-aminopyridine. It works, but you've got to develop a new drug, and here's what they said, that works as well as 4-aminopyridine. I must be losing it. Oh, then I realized the patent for 4-amino was expired. The drug was being sold at $4,000 a month. Now it's $100. You can show you I'm not that smart. I should have picked that up right off. It has to do with the money. So I started just, all of a sudden, all these diseases that I hated. I like it when people with dementia go on Aricept or whatever. But if you look at the absolute risk reduction, those drugs, which is what you take a drug on, absolute risk reduction, work about 2% of the time, and they work for about 9 to 12 months. And this is the drug company's own studies. So I love the pharmaceutical algorithms that everybody's using, but when they're not getting where they want to be, instead of just saying, well, we all got to die sometime, get used to it, I have a whole new set of things that I can do with my patients. And that's why I love medicine. Because I can actually get people better. And it's just very, very interesting. So I'm all excited, and I have this bright idea, and my wife is not too excited. And one thing I never do, I never go against a woman's intuition. If my wife says I don't, I may be ticked off and this is so stupid, but I've learned never go against her. So I said, all right, let me just check out a little bit. And so what I did is I called a friend. And he says, I want to do this on Channel 9, Spectrum. They have that medical thing. I've talked to Fox News and some others, and they're interested. And he said, don't do it. Do not go on television and say anything. Why did he say that? Well, I work for myself, but so he said, here's what they're going to do. You're going to say that, and then they're going to bring on the head of neurology at University of South Florida, who's going to say, as I just heard him say the other day, but he's going to say, Dr. Young, nice looking, tall blonde. I think he means well, but I'm head of the department. I've won 17 national awards. I have 30 journal articles. I am considered one of the top in the field. There is no cure for Parkinson's and dementia. I thought, you're right. I'll look like an idiot. So about 4 weeks ago, Sloan Kettering Hospital, New York, released a Parkinson's study. And here's what they said. We took 4 patients with severe Parkinson's, and what we did is we took BDNF, that's going to be on the test, BDNF, brain-derived neurotropic factor. It's like the foreman for the construction company. Everything goes through the foreman. Brain-derived neurotropic factor controls the ability to regrow neurons, which we were told in medical school you cannot regrow them. It helps them survive in severe stress situations or in traumatic brain injuries. Helps them get through that. And rebuilds new neural pathways through the hippocampus, substantia nigra. You can do it all. What they did is they took BDNF, put a hole in the skull, and through PET scan and surgical procedure, took a needle deep into the brain stem and in the caudate nucleus, where dopamine is made, and it's not being made then because they have Parkinson's. They put BDNF there. And guess what? The brain started to make dopamine. And of the 4 patients, 3, you could never tell they had Parkinson's. So what they say, they said, it looks like we may have a cure for Parkinson's. But we're going to do some more study and do a 5-year study and get maybe 12 patients in it. Then, a few days later, University of California, San Diego comes out with their big announcement. We took BDNF, put a hole in the skull, went down deep in the brain, and injected brain-derived neurotropic factor into the hippocampus. Now, they also made a note of this. We did nothing for the amyloid and tau tangles in the brain. USF, Miami, Gainesville, Johns Hopkins, everybody is on the idea we've got to get rid of amyloid tangles in the brain, tau tangles, alpha-synuclein tangles. It's all messed up. It shorts the whole brain. They didn't do anything with those. They put it straight into the hippocampus, which is the main computer, and the brains came back in 3 out of the 4. The amyloids, the taus, they're red herrings. They're going after the wrong thing. 2 big institutions have already told that. And I've gotten a couple of those patients from Miami and USF where, yeah, they have no amyloids in their brain, and they're still as loony as can be. It's not the tangles, and they spent billions coming up with a vaccine because that's where the money is. I think it's 3 shots, 18,000 first, 12,000 the second, and 6,000 the third shot. So I called UC San Diego. I'm the dumb blonde. And I said, listen, I've done my own study, and I've got about the same results as you guys. Why don't we collaborate, and you can do it for a lot less? I said, I can do it for about anywhere between 6,000 and 8,000, and you're charging 50,000. And, the head of the department, Turnsky, replied, a nice 2-sentence reply to my email. Dr. Young, we already have our protocol. Never get in touch with us again. It's not about getting you better. It's the money. Now, I do not use brain-derived neurotropic factor because it is very expensive, but stem cells make brain-derived neurotropic factor. Now, the thing we don't know is we don't know the dosages. It's not like amoxicillin, 500 milligrams 3 times a day for 10 days, penicillin gets rid of strep throat. I don't know whether it's 30 million stem cells, 60 million stem cells, 500 billion exosomes, 250 billion, whether they all need ENBREL or not, we don't know that. We're coming up with some pretty good ideas. But what is really, I want to come and just, talk to this, is tell you guys that there may be other ways. And listen, I am so thankful for my medical training, but that took me only so far. And if you're going to get better, you're going to have to go outside the box. But what I am doing now will probably be what's going to be standard in about 7 to 10 years, because that's the lag time between what's in the biochemistry journal and what's in traditional medicine. So I hope I didn't spit on everybody. Do you want to open up for questions? I can't imagine anybody would have a question.
Yeah, if you guys have questions, raise your, I'm sure we're going to have a lot.
All right. Yes. Get that guy. Get that mic.
Thanks for being here. Has any of this information been bumped up to Bobby Jr., Bobby Kennedy Jr.?
So, all right. So, no, I sent an email to Luna, my congresswoman, and I do know her number 2 in her office. I still haven't had a reply. You know, I'm just a little guy in the back of an office park. You know, but I have sent an email just saying I would like to get a meeting with, you know, with RFK. We'll see. We'll see. But I'm not holding my breath. You know, the guy that I'm talking for, he hired, you know, he's got to the White House, so I don't know. But, yeah, but the thing is, I have sent off a letter, email, and did exactly what they asked me, and I'm going to send another email and just say kind of what's the status. I am using Professor Hollick at Boston University, who's been nominated for 3 Nobel Prizes in medicine, and I'm trying to get him and maybe go through him to get into RFK. So we're trying. Okay. Yes.
Question. When you're doing it, would it be easier on the patient and everything if you went up through the lumbar area rather than through the skull?
Well, first of all, I don't go through the skull.
Okay, that's...
I mean,
that's
but I'm going through the lumbar. You're going to have to stay bent for a fair amount of time. The easiest is for me to go 1/4 inch in your back, inject, and that's that.
That's right.
That is that.
Yeah. Now,
It is literally a walk-in, walk-out.
Now,
procedure.
were you only doing 1 injection, or do you do multiple?
So, if I'm giving Enbrel, that's a 1 injection. That takes 4 seconds to give. Stem cells and exosomes, I do as 1 injection. That takes about a minute to give because you have to give it slowly because putting those stem cells through a small needle, you could mess them up. So, but that's basically it. And then they have to stay down for 5 minutes.
Well, why are they they have four sessions and they charging all that? Why can't they do it with 1 session?
Who's charging 4 sessions?
The hospital, San Diego area. When you say they did 4?
No.
Oh, I thought
they just did a one-time deal, but they made a surgical procedure, cutting out part of the brain, part of the skull, so they could get the needle all the way down into the stem cell,
right.
stem of the brain, and injecting it.
And they just did it 1 time.
Yeah, 1 time.
Thanks.
No problem.
I'm a retired physical therapist. So I'm glad you mentioned physical therapy.
We love them.
Doctor, of all of those that did not work, was there any common denominator? Which part of the brain was related, or anything like that?
I haven't found that yet. Still looking. Now, I do find in some of those, 4-aminopyridine does seem to help some. So, you know, and I'm always looking. And that's why I kind of like Sherlock Holmes, always trying to figure out why. So I'm also doing some stuff with, Professor Hollick, who I just referenced, was former head of the Presidential Commission on Vitamin D. If you Google him, he's #1 in the world on vitamin D and a couple other diseases that he found. But basically, Hollick, all right, how do I want to answer this? All right, so a couple things. Hollick always said, get the vitamin D levels very, very high. which also acts as an anti-inflammatory in the brain. Number 2, I do use 4-aminopyridine, but then we talked about a process called de-differentiation. Anybody heard of that? I thought I fooled Hollick, and he said, no, I've heard of it. I'll tell you about it. Shoot. Just when I thought I stumped him. So de-differentiation means that in that first 8 weeks when you're in the womb forming, there's 22 fibroblastic growth factors that form the brain, the heart, the eye, the lacrimal gland, the epithelial tissue in the lungs and the ear, that these fibroblastic growth factors form what we are, and then we grow from that. So I will put them sometimes on fibroblastic growth factor for my Parkinson's. I'll put them on fibroblastic growth factor 20 because that causes, 20 is involved in the formation of the caudate nucleus that has to do with dopamine production. But the other thing, which is very interesting, it also has to do with the formation of the cilia in the bronchial tubes, little hair cells. And at the same time that that's forming, in the ear, the choroid plexus, where the little hair cells attached to the nerve so you can hear, are forming. So I had a lady that I tried a couple things on, didn't work, but very, very deaf. So I said, let's try something. You can't get fibroblastic growth factor 20 in America. It's outlawed. I don't know why it is. But there is a drug that causes the body to make fibroblastic growth factor 20. It's called albuterol. You think of the inhaler for asthma? It's the tablet. 4 milligrams twice a day. So she goes to my church. I put her on it. 3 weeks later, she comes up to me. You notice anything different? You change your hair? No. My hearing aids, I don't have them anymore. I can hear perfectly fine because I use that to grow back the hair cells, which they say you can't grow back, but it's called the process of de-differentiation, going back to the embryonic stage and regrowing the system again. So I will do some of that with these that aren't working, but there's just a lot of things to try that are very safe. Yes.
Yeah, I was curious. I heard you mention the 2 success stories you had. With that same combination, have you had other times it didn't work, or have you had to modify it?
Yeah, I mean, I've had so I'm running like with Parkinson's and dementia. It's about a 70% success. Now,
With the Lewy bodies also?
I've only done 1 Lewy bodies, and I'm waiting for more. But the fact that no one's ever been able to get rid of them in medical history, and I did. And plus, I know exactly what exosomes will do because they get rid of the debris, and I use the exosomes to get rid of the synuclein protein. So, listen, I am not that smart, but I learned to read, and my 2nd grade teacher taught me to read, and that's why I know that. Thank goodness for Mrs. White. Next
Any other questions?
Yeah, question. Are there any risks or side effects associated with these procedures that you're describing?
So if you look up any of the monoclonal antibodies, there is a problem with kind of long-term use destroys the immune system. So in people that are getting it for ulcerative colitis or rheumatoid arthritis, getting it every week or every 6 weeks, over time it will destroy your immune system. Giving it once or twice ain't going to do a thing. 1 beer is not going to turn you into an alcoholic. 10 beers a day for 3 years, probably there. So, the company that makes the antibodies knows what it's done in the strokes. But here's what they said. it's not worth it. It's a $40 to $80 million FDA study to get it approved. You're using it once or twice. We're selling our drug, they're using it every week. There's a lot of money there. There's no money in it, a 1 or 2 time use. So they said we're never going to go after that. But remember, 60% of the drugs that your doctor prescribes for you are off-label use anyways. Anybody been on proton pump inhibitors? Nexium? Okay. That is FDA approved. How long you been on it for? All right. Anybody on it? Yeah. How long you been on it for? Ooh. All right. It is FDA approved for 8 weeks. So your doctor's using it off label. It does kind of destroy the bones. But, but we're allowed to do that. I'm just saying. So that's why, yeah, in the state of Florida, if you can show, well, really anywhere in the U.S., if you can show scientific literature that's being used for this and this, the really governing boards don't have that much problem.
Okay.
Next,
Dr. Young, I got to thank you. This was most informative. I can't wait for July because we have lots of issues. We have another doctor here that does a lot of presentations, Dr. Norman Anderson, who's sort of just like you and doesn't follow and treated a lot of people and cured a lot of people and is fighting following the money. So that's really kind of important. This was one of the best talks I've heard in a long time. Thank you very much.
thank you for having me.
So, thank you guys for coming. Next month we have a different doctor who's going to talk about some of the same things, but that's okay. And then he'll be back in July. We have donuts and coffee in the back. And thank you guys for coming. Have a great evening.